We use what you call the contractility of the heart to assess the progressive damage that the heart acquires over time. And that affects how the clinical state of your patient, if they're able to do exercises or their general activities on a day-to-day basis. So the contractility is basically what you talk about. You're told your ventricle is not contracting well, and that happens as the disease progresses. So initially what you would see is your chest x-ray is taken and you're told your heart is big, which is an adaptive measure that your heart takes to the damage that it's been progressively undergoing. And it modifies, or the structure of the heart keeps changing depending on the disease process that's ongoing. So you're told you have a big heart, and definitely the heart that's that small and the heart that's big will not be functioning the same. Definitely the contractility may be different. So that's what we mainly use to assess the function of the heart.
Ani muche inaitano bole negit is heart attack.
The most common sign that you may be having a heart attack is usually chest pain. The classical sign would be chest pain that you're told either relates to your jaw or to your shoulders, and it's usually a sharp pain. It may be start off on exertion, like when you're doing an activity, you have your chest pain, and then when that starts, you should go to your physician and explain that, because those are first signs of what they call angina, the chest pain, that progressively would lead on to the classical heart attack, what is called the myocardial infarction. So the chest pain is one of the most classical signs that you may be having a heart attack. Some of them describe it as they're seated and all of a sudden they hear their heart is beating fast and strong, and that's one of the symptoms we call palpitations that a patient may present with when it comes to heart disease. Usually that happens even when you run and you stop, all of a sudden your heart is beating very fast. That is normal. But when you walk 50 meters and all of a sudden you start getting palpitations, and previously you would require to run a whole lap of 400 meters and you get palpitations, then that's something to watch for. When you're seated and all of a sudden you start getting the palpitations, that's something to report about. So if you know someone who has had a heart attack before, or you've seen someone who has had an attack before, the first thing you probably should do is get them to hospital immediately and as fast as you can. Emergent and urgent treatment for the heart attack is very crucial to make sure the effect on the heart is minimized and can be evaded as much as possible. The symptoms are usually seen way before the patient has the first incidence of what they'll present with a heart attack. They may have had the repeated episodes of the chest pain before, but no one takes note of it and you brush it off. It's just a chest pain. It came, it stopped, and that was it. You get shortness of breath when usually you'd walk 3 kilometers and get short of breath, but now you walk a kilometer, you walk 500 meters, you walk 200 meters and you get short of breath. Such symptoms are something that you should present to your physician way before way before you start having the severe chest pain that you would actually be diagnosed with as having a heart attack.
Akot kounoto, komwae Dr. Violet kole mi biik che maimuche ketoret ak yatitaetab muguleldo. Ak en biik cheu chuto ko kikochin kerichek.
Unfortunately, yes, there are patients whom we get to see, and unfortunately the heart has been burdened and has suffered long enough such that surgical intervention is not an option for them at that point in time. So what do? The way we channel them is through medical management, make sure that we improve their heart function as much as we can using the medications that we have. And we have what you call palliative care, which, yes, it may sound morbid, but it's actually making sure that every patient that you see is comfortable with whichever disease they have. It doesn't define which illness, it's every individual that is catered for is made sure that they're actually comfortable. So we can enroll them into palliative programs which are widespread throughout the country, available to even the nearest health facility that's closest to where they stay. And if they need analgesics or if they need an urgent refill of the medication, they can actually get it.
Kora, komi biik che kokochin mashinit netoreti muguleldo ne naat ko pacemaker.
There are certain illnesses that affect the electrical conductivity of the heart, and that's when a patient is deemed to need a pacemaker. For such incidents, for such occurrences, they actually get a small gadget that's fitted and helps to make sure that their heart beats at a rate that's regular and enough to actually support perfusion of the entire body, because once it becomes like the rate drops to a certain level, the blood pressure may drop and the patient may actually present with what they call syncope or fainting episodes, lightheadedness, dizziness and such like symptoms. So that pacemaker is fitted. It definitely requires, like any other machine, it will require subsequent follow-up, just like any other procedure that is done when it comes to heart disease. For our post-operative patients who have had open heart, most of them require what you call lifelong anticoagulation therapy. Now, depending on the agent that you use for anticoagulation, most of the time we use what you call warfarin, and that requires repeated monitoring. It has its implications when it comes to diet, what you can take and what you cannot take. So for such patients, we advise, especially for the greens, it will be leafy vegetables, it will be apples, green apples, it may be avocados. They require a constant amount throughout. If they can manage to do that, that would be the best thing instead of the fluctuations, because that alters the lab test that is used to monitor thereafter. So we just advise a constant amount of the greens in their diet constantly. But for the other agents, if they use aspirin, then they may not require such close monitoring, though they still will require follow-up.
Kamwa Dr. Violet kole en wikit agenge kotoreti Tenwek Hospital biik chesire 10 chetinye kaimutikab muguleldo.
For our particular facility here in Tenwek Hospital, I can gladly say over the last about 5 months, we have made it a regular practice to do about 4 to 6 cases every week of open heart surgery. So that will total to almost every month you have 25 to 30 patients who go home after their open heart is done, particularly for the last 6 months. The insurance actually helps when it comes to catering for the financial costs of these patients, and that would be the emphasis that I would lay across. if everyone can, yes, register for the NHIF. It's a national fund. Anyone and everyone is eligible to have it, from the child who's born today to the elderly grandmother at home. Everyone is eligible to have it. The private insurances are also there for those who can be able to access it, and that will help them access whatever form of healthcare they will require when it comes to their cardiac disease, regardless of the facility they go to.